27% of cancer deaths are caused by lung cancer, and November is Lung Cancer Awareness Month. Carolee McGrath sat down with Dr. Rousou, the medical director of the lung cancer screening program at Holyoke Medical Center, to learn more about detection and treatment of this type of cancer.
We now know that lung cancer, at least in this country, causes about 250,000 deaths per year. Now that number is more than breast cancer, colon cancer, pancreatic cancer combined per year. So we know lung cancer is a very prevalent, very deadly problem. And the reason it is so deadly is likely because when we found lung cancer previously, we found it late stages, stage 3 or stage 4. And it's very difficult to treat any cancer in late stages, but in particular lung cancer. So that was the nidus to develop a lung cancer screening system of some kind. And people have been trying for years, but with a large trial across the country, low-dose CAT scans were used in smokers or former smokers on a yearly basis to see if we could flip the script and find lung cancers at earlier stages and thereby be able to treat it better and decrease that mortality from lung cancer. And what we found in that study is that the lung cancers found with the CAT scans were early stages as opposed to late stages as they were before. And what that ended up meaning in the end was that there was a decrease in death from lung cancer in that trial by about 20%, so a very substantial benefit. And that's really how lung cancer screening sort of came to be, and low-dose CAT scans came to be. And at Holyoke Medical Center, that's why we saw the value in that, and that's why we decided to start a lung cancer screening program.
So tell us a little bit about the program at the medical center. You know, who is somebody who would qualify for that program and the ages?
Yes, so the criteria for qualification for lung cancer screening at Holyoke Medical Center is the same criteria they used for the study that I just talked about. So age 55 to 80, smoker or former smoker, and if you're a former smoker, you have to have quit within 15 years. There's some details about how much smoking you would have to have done to qualify, but that's, that's sort of a detail that we can work out as we see people and counsel them about their smoking and lung cancer screening in general.
Is it essentially the CAT scan, or there must be other components as well?
No, so there certainly are other components, and the way we design the program is there is a visit. So it's basically a referral to a program that your primary care might make, or people can make themselves if they meet the criteria. And you come in for a visit with one of our advanced practitioners or myself, and we talk about what the program is. So it's a yearly low-dose CAT scan, and how they get the results, what the benefits are, which we just talked about, what some of the risks are, and that day you get your low-dose CAT scan. Within a week or two, you get the results, as does your primary care physician, of the CAT scan, and it's scored on a risk scale. So 1, 2, 3, 4, 4 being the highest risk, and 1 being the lowest risk. And most people, the vast majority actually, are 1 and 2, and then there are 3s and 4s, which are dealt with a little bit differently. If you get a 1 or a 2, then the letter that you get and the letter that your primary care gets is going to say, okay, we'll call you when it's time for your next low-dose CAT scan, which will be in a year. If you get a 3 or 4, we review it as a group. So there's specialists there, like myself, a surgeon, thoracic surgeon. There's pulmonology there. There's oncologists there, radiologists, and pathologists. And we discuss, what do? We discuss the patient, because either myself or one of our advanced practitioner has seen that person. And then we discuss the imaging and decide what the next step is. And then that next step gets communicated to the patient and to the primary care as to what the recommendations are. So are we going to do a biopsy, or are we going to do a CAT scan at a shorter interval, so 6 months instead of a year? things like that. And by doing that, we sort of get a captive audience, a group of people that are engaged in their health and willing to participate, and we sort of get people through difficult times
Right.
relatively quickly.
So how do you handle people, who are smokers and they just can't kick the habit? And obviously they know they have this huge health risk, and they have this habit that is just so difficult to break free from. How do you encourage those people?
Right. So, well, one of the things that's interesting is that in that trial, and then in subsequent studies since, but in that trial, smoking cessation was a part of what they looked at. So to have a lung cancer screening program without smoking cessation, that just doesn't make any sense.
Right.
And what they found, though, in that trial is because it's a captive audience and you have various different avenues to educate people about smoking and smoking cessation, they were having a success rate for smoking cessation of about 25%. Now, the national average for smoking cessation is 7%. Ooh. So it's a huge difference. And the reason for that probably is because, one, it's a captive audience, and two, there are avenues we can go down that other people can't. So we have a physical picture of the lungs, and we can show that picture to a patient that's trying to or wants to stop smoking and say, this right here is emphysema, that's from smoking. Some of that will get better.
What's the reaction that you get from patients?
A lot of people are shocked at if you show them a normal CAT scan and then what their CAT scan looks like. They're shocked, they're scared. And so it can spark maybe that final thing that's going to make them ultimately stop. The other aspect of it is that there are multiple avenues that you can go down to stop smoking. So there's patches, there's programs in person, and there's programs over the phone supported by the government. There's all sorts of resources that we can give to people to be able to stop smoking.
And they know that they're supported through the program as well. You have an event coming up to inform more people, about the very real danger of lung cancer. Tell us about that.
That's right. So it's a community education discussion, really, at Holyoke Medical Center in one of the conference rooms, where it'll be myself and some other experts within the program talking about lung cancer screening, a lot of the things that we just discussed here.